channel My Expert Doctor. I am Dr. Shalini Singh Salunke with you as a consultant physician. So sorry, the hospital is going very busy. We have no time to make any video over there. So I've decided to make video from home only. Now, in the previous videos of Corona series, we have seen that how Corona is affecting our life, what is Corona, how can we protect ourselves, the preventive measures. We've also seen what are the symptoms of Corona, what lab tests need to be done once you develop symptoms of Corona, and on the basis of the lab results and your symptoms, how are you going to get divided into mild, moderate, or severe COVID-19 disease. If you have not seen that video, please go and watch. The link is given in the description box below. If you are appreciating our efforts, please hit the like button and share it with your near and dear ones, your friends and families, so that they will also get benefit out of it. Also, do not forget to subscribe this channel so that you will get the notifications of upcoming videos. Now, starting today's topic, as we have discussed in the last topic that there are around 80 to 85% people who will be tested COVID-19 positive, but will not require any hospital administration because of their mild symptoms and will be advised to take treatment at home only, which is called home quarantine. So let's discuss something about home quarantine, the basics of home quarantine rather, so that more and more people will get benefit out of it. Starting today's topic, the first and foremost, who will require home quarantine? First thing, asymptomatic patients. That is the patients who do not develop any symptoms either before testing or after testing while staying at home. Maybe because they have just contracted little amount of virus load with some because they came in contact with some positive patients. The second thing is people who develop mild symptoms like sore throat, mild cough, cold, weakness, fatigue, body pain, low-grade fever. These patients have okay lab reports and will not require any admission as advised by the doctor, will stay at home only. The third category is the high-risk category people who have mild symptoms, but for them to be home quarantine, they have to be evaluated thoroughly by the consultants or doctors. Only then they can go for home isolation. So next is, what is the requirement of home isolation? Again, first thing is that there should be a isolated or separate room for the patient with a separate washroom, and the room should be well ventilated. There should be a window to allow free movement of air. Then the second thing is there should be a caregiver available to the patient 24/7. And third thing, there should be an established communication link between the caregiver and the hospital or doctor, so that when the patient develops some symptoms or there is worsening of the existing symptoms, they can immediately contact the doctors or hospital and can take appropriate treatment. Okay, so now the third important thing, there are certain tools which you have or items which you should procure whenever you are isolated or going for home quarantine. They are mandatory. They will help you during your stay at home. What are they? The first two important things are your clinical thermometer and your pulse oximeter. Clinical thermometer will help you to check your temperature. If you are getting fever is increasing or decreasing, what is the effect of your antipyretic on fever? For that, clinical thermometer is essential. Second thing is your pulse oximeter. Pulse oximeter is a small device which will help you to check your oxygen level in your body. It's of utmost importance to have a pulse oximeter for a patient. Now, how does it function? You have to apply it. For the best results, you must apply it on the middle finger of your right hand. Once you put it into your finger, you have to switch the button on, and then you have to start taking deep breath. If you are not taking deep breath, you will get false low results or lower oxygen levels, which will be alarming. So take deep breaths, and then once the waves formation in the pulse oximeter is constant for 10 to 20 seconds, whatever numbers you are getting on the screen of the pulse oximeter is your original or real oxygen level in your body. There are certain things which you should remember before you put pulse oximeter into your finger. The first thing, specifically for females, there should be no nail paint, mehendi or tattoos applied to your finger. Otherwise, you will get a false result. And apart from that, you should not move much or move your fingers a lot while checking the oxygen level. And you should not put it too tight or too loose, because if you're putting too tight, there will be no blood flow. Since there is no blood flow, you cannot check, the machine cannot detect your oxygen level. And if it's too low, again the problem will be the same. So this was all about your pulse oximeter and how to check your oxygen level at pulse oximeter. Another important thing is your mask. You should have two types of mask, N95 and triple layer mask. How to apply a mask on the face, how to discard it, when to discard it. I have mentioned everything in detail in my previous video. If you have not watched that video, please go and watch it. The link is given in the description box. Apart from mask, you have to procure some gloves as well as some hand sanitizers and hand wash. That should be separate for you. Again, the hand washing techniques, hand sanitizing techniques have been explained by me in my previous videos. Please go and watch it. Again, the link is given in the description box. Apart from that, you should have a closed container in which you will discard your used gloves and face mask. You will put some 1% sodium hypochlorite solution in those discarded gloves and masks so that it will get disinfected. Then you should have some face shields as well, because whenever the caregiver is coming into your room, you have to apply N95 and a face shield to reduce the risk of transmission of the disease to your caregiver. Apart from that, there are some over-the-counter medications which do not need prescription of a doctor, but these are very important for you while you are staying at home for your home quarantine. So what are these medications? The first one is your antipyretic to reduce your fever. You can take it twice or thrice a day also. Common names are paracetamol, Crocin or Dolo 625. Apart from that, there are multivitamins that you must have. Vitamin D3, vitamin C, zinc supplements, because these all are known to have some effect to build up your immunity. Their deficiencies cause lowering of the immunity, and you know that to fight COVID infection, we need our immunity. So these things will definitely help you. Thus, they don't have any side effects as well because they are water soluble. They will be out of your system within 24 hours. That you must have your gargles so that you can soothe your local sore throat and irritations in your throat. And you should also have lozenges like Strepsils and Vicks, which will help you to soothe your dry cough, which is a very, very prominent troublesome factor in COVID-19 as a symptom. Now let's move on to see what all we have seen in this entire video. The first thing, that for whom home quarantine guidelines are made or who can have home quarantine. Second thing, what are the requirements of home quarantine? And third and very important thing, what all items you must procure before you go for a home quarantine. Now in the upcoming video, next video, we are going to see what steps a patient must take while in home quarantine to treat them. Second thing, what precautions they should follow so that their family members will stay safe while the patients are in their home quarantine. Third important thing, when will their home quarantine end and they will be considered discharged. Fourth important point, is it necessary to have a repeat swab test while the patient or at the end of the home quarantine? We will also see a very important thing, the red flag signs or the danger signs which you must be aware of, so that if you watch it as a symptom in you, you immediately contact your doctors, so that if hospital admission is required, you can go ahead with it. So this is all we are going to discuss in the next video. Till then, have a nice day. Thank you.